It's important to remember how fortunate Australia has been, really, in world terms. The US has now surpassed 350,000 deaths, while Britain is about to go into another lockdown. But the recent outbreaks in Sydney are raising concerns about how the virus entered the country despite our strict quarantine measures. Nadia Daly has more.
On the beaches, surf lifesavers will be looking out for overcrowding.
It's real concern that this cluster has spread far beyond the northern
Authorities are racing to slow the spread of the virus, and they're pleading with Sydney-siders to take it seriously.
We need to find the source of the infection.
250,000 Sydney-siders are tonight in lockdown. And the rest...
Sydney is now battling two COVID clusters, with almost 200 people infected across the state. They're two separate strains, both came from the US, but there's a lot we don't know. And there are several missing links in the chain of infection. Cases have now popped up in Melbourne and regional Victoria, believed to be linked to the Sydney clusters. And authorities are bracing for a further spread into outback New South Wales.
If you have any symptoms, if you are concerned, you should limit your mobility. You should limit travel to regional and rural New South Wales.
So here's what we do know about the origins. In the northern beaches, the so-called Avalon cluster has now grown to 148 cases. It started at the local RSL and soon spread elsewhere in Sydney. Then a second outbreak emerged in Western Sydney. It's believed to have come from the colleague of a patient transport worker who visited a BWS liquor store before testing positive. That cluster now stands at 15. A confirmed case from the cluster is now known to have travelled all the way to Broken Hill.
An 18-year-old man from Baralla who has tested positive, who travelled from Baralla to Orange to Nyngan and then to Broken Hill for a camping trip, is of concern for the government.
While the Avalon cluster became known when two residents of Sydney's northern beaches tested positive to COVID-19 on December 16, it's still not known how they contracted the virus.
Is it concerning that we don't know who the source of the Avalon cluster, the patient zero, so to speak?
You would love to have every case absolutely linked, but occasionally that's just not possible. In this case, whilst they're still looking for that source case, there's no certainty about it.
And authorities are scrambling to determine just how so many people got infected from the BWS bottle shop, with a test and isolate order in place for thousands of people who visited the shop over 11 days.
That is actually a high level of concern for all of the public health officials, because it was a very small window that the person was there, and yet the virus seemed to have transmitted extremely quickly. So that's what's put us on high alert in that Baralla area.
The overarching question is, how did two separate overseas strains get through our quarantine? Epidemiologist Mary Louise McLaws has criticised the government for focusing on the response rather than the prevention of outbreaks.
The response is very reactive instead of being proactive. I come back to this idea that we shouldn't be relying on contact tracing. We should be relying on protecting staff and testing staff before they start to get symptoms to then be identified.
Should the drivers of these transport vehicles be tested daily for COVID?
Public Health in New South Wales have now implemented regular testing of those drivers.
Until last month, hotel quarantine for international aircrew was unsupervised. But after 9 aircrew were discovered visiting venues in Sydney, they copped hefty fines. In response, the New South Wales government tightened procedures, forcing international aircrews to stay at police-monitored hotels near the airport.
Would you say this is a failure in the hotel quarantine system?
Australia has had the challenge of international aircrews flying in. There were, I think, sometimes unsaid and sometimes said, a clear understanding that they may stop flying to Australia. So there were some challenges. But I think the system that we now have in place and has generally been adopted around the country is a lot better.
This is the greatest risk to Australia, and we need to shore up our quarantine, hotel and treating travellers as they come in.
So we are doing our best. It does require additional vigilance, I think, and we've also seen that the rate of infection from overseas travellers is increasing, to some extent reflective of the pattern overseas. You know, we are seeing more infections in our returning travellers.
Sydney has borne the brunt of hotel quarantine, hosting more return travellers than any other city. And Professor McClaws has for months been calling for quarantine hotels to be based outside of capital cities.
Because you don't put a high-risk group into a highly populated area. So they need to be put out into a regional area with highly trained experts where people can go for a walk without having to be chaperoned and placing staff at risk.
What have we learnt from this that we might implement to prevent this sort of outbreak happening again in the coming months?
I think we all were lulled into a false sense of security, particularly the community. Everybody needs to be on high alert. Even if we get this vaccine, we must accept that COVID-19 is here for the long haul.